good morning. I'm Dr. Queen. I will be your doctor for today. I'm one of the main practitioners here at the hospital. And I mean, if you don't mind, I would have a series of questions to ask you based on what I've been told about your case. So if you don't mind, could you tell me what your main complaint is today?
Well, I took 5 pregnancy tests and all of them came back positive. And me and my husband, we weren't even trying to have a baby.
Yeah.
Yeah.
Okay, so when did you notice this changes? What's the duration and all of that?
Well, my period, it all started 6 weeks ago. My period, it just came in spots. And I would usually lose 5 pads a day and it lasted about, for a while. And I just noticed that I just used 2 pads. And that was it. I just had these little spots of blood. And it alarmed me. So I was waiting for my period this month and it didn't show up. So I just decided, my husband was like, oh, you should take a pregnancy test.
Okay, I understand. So, when was your last menstrual period?
Well, as far as I can remember, 6 weeks ago.
So 6 weeks ago.
Yeah.
Alright. So from that, I can tell that you haven't had any this month.
No, not at all.
Alright. So, and if you don't mind telling me, when did you get your first period?
If I do remember correctly, it was about 14 when I was in class.
Do you have any menstrual history, irregularities, problem with your menstrual cycle of any sort?
Well, ever since I was 14, it just came, and every month after that, it just came the same date. It was pretty regular, I think.
You was one of the lucky ones then.
Yeah, I guess.
Yeah. Okay. So, well, you say it just came with that, so you don't get any pains of any sort, no cramps.
No, I actually don't. I don't even have to take a painkiller.
Oh, you really are one of the lucky ones.
I know, right?
You really are. You don't even get spotted in between your periods, no spotting in between.
You mean blood?
Yeah, just drops of blood in between.
No, I've never experienced anything like that.
You really are lucky. So, I know that you're married, Mrs. Tanya.
Yeah.
I know that you're married, but do you and your husband have any form of contraceptions?
I do the pull-out method. And
do you have any previous pregnancy or pregnancy scares or miscarriage?
No. This is the first weird thing that has happened to me.
The first, you say?
Yeah.
I want to know your sexual activities, if you don't mind me asking, if you have any other partners except your husband, or it's just your husband?
Oh, no. There's no one except my husband. He's the only partner I've been with ever since a year ago that we got married, and that's basically it.
Okay.
Yeah.
So, and you don't have any history of sexually transmitted disease?
Oh, no.
None at all?
None at all. Not that I know of.
Okay. So, how do you feel? Do you feel nauseated? Have you been vomiting?
To be honest, in the last month or so, I've just been feeling so nauseous. It's I just smell food and it's I just want to throw up all the time.
You don't have any kind of bleeding after sex, do you?
Oh, no. There's no bleeding.
Okay, no bleeding. And you don't get no abdominal pains, normally or after sex, during sex, before sex?
No,
not
at all.
Okay. And how's your appetite food, eating and all of that? How does it,
Honestly, I really don't know. It's just the things that I used to love before. I hate them. And
you have any changes with your weight?
Well, I tried to put on my jeans this morning and they weren't buttoning up. Can you believe that?
Do you feel exhausted, tired?
Exhausted. Actually, yes. This morning it was such a struggle. Let me tell you, Doc. I woke up and I just didn't want to get out of bed. And it was the same thing for the last couple of weeks. It's just during the day I just want to sleep. I want to sleep through the night. I want to sleep through the day. I get nothing done and it's exhausting even thinking about it.
I can understand how you feel.
Yeah.
I can understand. So how about your breasts? Do you feel you have discharge, or do you feel it's been tender?
Well, lately I have noticed that they are a bit full.
I see that you're quite healthy, and
yeah.
Have you had any kind of pap smear?
Actually, yes, I do get those checked regularly. That's a doc, and I have to get those checked. So yes,
nice.
I think.
When was the last one?
8 months ago, I think. And what I heard, the doctor said it was normal. So
Oh,
yeah,
okay.
good to go.
That's great. That's great. And you haven't been feeling any form of fever, like no fever or any sort?
No, actually, I've just been normal lately.
Oh, well, movement like.
Lately, well, during the day, I mean, I go once a day. That's alright. I think
Yeah.
that's normal.
That's quite normal.
That's
That's
quite
actually
normal.
very normal.
Okay, well,
What about
I
your
drink a lot of
urinary?
water.
Oh, so
Yeah.
I would like to ask about your urinary habits. How frequently do you use the toilet and all of that?
Actually, I've just been urinating way too much lately.
Yeah. I understand that you feel fatigued, but do you also like feel like shortness of breath? Like you can't breathe going up the stairs, going down the stairs, walking around. Do you have any of that?
Actually, no. I was just so tired coming here, and I just have to sit down all the time. That's like the only time I can just like be normal.
Oh, you don't have any form. I mean, you have great skin. Do you have any form of skin changes?
No, I haven't noticed anything with my skin lately.
Okay. How frequently do you exercise?
Oh well, you might be shocked to hear this, but I actually run 5 miles a day. 5. Can you believe that? I didn't either, but I run 5 miles a day. But I guess lately, no, I haven't been.
Oh, I'm so sorry about that. It could be all the fatigue and all of that, yeah?
Yeah,
Okay. Are you currently on any meds, any medications?
like Panadol or anything like that.
Yeah, like painkillers, Panadol, vitamins, anything?
No, I'm not, but I do take a multivitamin.
Oh,
I take one every day.
okay.
There's one a day.
Okay,
Yeah.
that's nice. So do you have any past medical history? You know,
What do you mean?
sickness, illnesses, been down a day, you know.
No, not that I know of.
And you had any past surgery?
Yes. I was 20, it's about 8 years ago. I had appendicitis, and they actually removed my appendix.
What's your family medical history like? You know, your dad,
No.
mom, any medical history?
Well, my dad, he's a doc, but he has diabetes. Can you believe that? He's a doctor and he has diabetes.
I mean,
And well, my mom, she's obese. And she has some thyroid issues, so I think that's why she's obese. That's what the doc said.
what do you do for a living apart from your life?
Well, I'm a graduate student. I graduated last year. But you know,
You drink. I mean, you're pretty young and you might want to turn up on weekends. So tell me what that is like.
oh, doc. The beers count.
Yeah, they do count because they have alcohol in it. But yeah.
Well, my husband and I, we drink about 2 beers a week.
In the name of youth, I'm just gonna ask this question.
Oh,
do you
yeah.
use any kind of like drugs? You know, cocaine?
Drugs?
or-
Oh, no, doc. Why would you even ask that? No,
No, it's
you try
just-
to take drugs?
I mean, you don't, but I have to ask as a medical doctor. I mean, the name of
Okay.
not even tobacco.
No, I don't smoke. I've never touched a cigarette in my life. I'm
Do you
not.
have any drug allergies that you don't have?
No, I'm not allergic to anything.
Oh, okay. That's sweet. Like this pregnancy, is it planned?
No, we've been part free.
Does that mean you want this pregnancy? Is it a desired pregnancy?
No, because it's a bit too early, but I think I'm gonna talk to my husband first.
Next question seems quite sensitive, so it would like just want to know, just to make sure if you're not going through any form of domestic abuse.
Oh no. My husband's a total sweetheart. The
That's-
sweetest. He wouldn't even hurt a fly.
Oh, that's you. From everything that I've gathered here, you appear to be pregnant, but we cannot be so sure. So
Okay.
I would like to order some tests for you.
Right.
So I would like to order an ultrasound
Yeah.
and a urine test.
Oh, okay.
Yeah, so I would like to take this form to the lab to
Yeah.
get the test done. So before you go, I would like to let you know that if you're going through anything, I mean, in form of domestic abuse that you can't talk about
Yeah.
right now, you could always come back to the office and discuss with me. I will try to find a way out. And with the contraceptive, I don't want you to be too surprised because pull-up method is not always 100% effective.
Okay.
Yeah, so it's like 80% effective.
Yeah.
So if you would like to discuss some other types or forms of contraceptive, I'm always in the office and you could just book an appointment and I'll be here to discuss it with you. And
surprising.
yeah. So there are a series of tests that you have to get done and yeah, I would just put them down and give them to you so you could just wait outside while I put them together and order the tests for you so you can get them done. So
Okay.
thank you very much for coming in today.
Thank you so much.